Welcome to today's webinar, Investing Wellness, Financing Strategies for Behavioral Health in Indian Country. Today, we're really excited to share and explore with you a new resource that we have developed here at NCUE, which is a comprehensive toolkit designed to provide innovative and sustainable financing strategies to support behavioral health initiatives within Native communities. So welcome and thank you all for joining us today. My name is Liz Best. I am a manager of technical assistance here at NCUE, and I'm also the project lead for the development of this toolkit, which we've been working on really for the past year at NCUE. I am joined today by Evey Maho. She's our Director of Technical Assistance, and she'll be helping with the Q&A today. And also a big thank you to Molly Connors, who is helping out with our chat, and she'll place some resources in there, and also to Carmen Toft, our Assistant Director of Communications, who's helping today with the slide deck. If you have a moment, we kindly ask that you place your name, your organization, tribal affiliation, and your title into the chat box. Next slide, please. I also wanted to share that this project that we've been working on is funded by the Pew Charitable Trust with support from Bloomberg Philanthropies. The views expressed are those of the authors here at NCUE and do not necessarily reflect the views of Pew. Next slide, please. And for those of you who are new to the work of NCUE, I just wanted to share a little bit about us as an organization. NCUE is a national representative of the 41 urban Indian organizations contracting with the Indian Health Services under the Indian Healthcare Improvement Act. NCUE strives to improve the health of over 70% of American Indian Alaska Native population that lives in urban areas supported by quality healthcare centers. Next slide, please. And just some quick housekeeping. We will be recording this session today, and we can share out the recording via an email later on next week. So if you have any colleagues that missed this session, you'll be receiving a recording of it as well. Next slide, please. Please also note that your mics have been muted upon entry today, and we always encourage participation and engagement in our sessions. So we invite you as participants to turn on your camera, post questions and comments in the chat box, and at the end of today's webinar, we'll have an opportunity for Q&A. Next slide, please. And then lastly, this is just a slide for those unfamiliar with Zoom. You'll see at the bottom of your screen, there is a little chat box, and you can type comments into there at any time. As I said, my colleague Molly will be following closely the chat should anybody have any questions. Next slide, please. And I just wanted to share on this slide my email address. So if you do have any questions about the toolkit or the resources that we share, please feel free to reach out to either myself or Evey. We're only two of the people here at NCUE that have worked on this project, but there have been many hands working to make this a really important resource to share with our communities. Next slide, please. So just a little bit of a session overview. We're going to start out with a quick polling activity, and then I'm going to give you an overview of the toolkit and what you can expect to find in there, and a little bit about the methodologies that we use to create the toolkit. Then I'm going to dive into what we really consider to be the heart of the toolkit, which are 5 strategies that we've developed. And then we'll wrap it up with a discussion and Q&A. Next slide, please. So we're going to start off with a polling activity. So if you do have your phones, we're using Slido today. When we turn to the next slide, you'll see a QR code come up. But I have 3 quick questions for us. So next slide, please. Great. So you can either scan the QR code or type into your Windows slido.com, and there is the number that you can enter. But our first question is, and if technology is on our side today, your answers will come into the screen. So we're interested in what is your primary source of funding that you're using for your behavioral health services at your organization? So lots of grants, IHS funding, fee for service. Grants and tribal profits. Awesome. So it seems like you guys are all using a lot of grants and third-party revenue. And as we go through the toolkit, you'll see that those are some of the strategies that we do elaborate on in our toolkit. Great. Next slide. Second question. Oops. How challenging is it for your organization to secure sustainable funding for behavioral health programs? Is it very challenging? Securing funding feels like trying to catch a rare fish in a vast and turbulent ocean. Somewhat challenging, like fishing with shifting currents, challenging but possible with patience and the right techniques, or not challenging at all, like casting a line into a stocked pond. Great. So we have 58% of folks in the room today, or 62 now, that it is somewhat challenging. So hopefully some of the resources and strategies that we're going to share will be helpful in helping you to secure that financing. Next slide, please. And then our last question for this poll is, what types of funding would most benefit your behavioral health programs? Grants, unrestricted funding, private donations, innovation grants, flexible use funding, third-party reimbursements. Got a few more people typing. Multi-year grants. Super. Well, it seems like even though we're all logging in from different places, we're all thinking much along the same lines. And we did hear that. We'll talk a little bit about the research that we did to inform this toolkit. And we heard very much of the same from our key informants as we did through this poll. So really appreciate everybody participating. And I'm glad that I have everyone's attention now. So next slide, please. So before we dive into the contents of the toolkit, I just wanted to share this slide, really looking at the areas that we looked at to identify the need for this toolkit. So just some quick facts. Currently, 19% of American Indian and Alaska Native individuals report experiencing mental illness, with a significant portion being under the age of 18. This high prevalence is deeply rooted in factors such as historical trauma, systematic inequities, and unique indigenous determinants of health. However, despite recent advocacy efforts to integrate traditional healing practices into behavioral health programming, we found that funding and policy support have not kept pace with the growing demand. Native communities face a critical challenge as existing funding models often provide only short-term grants that fail to address the ongoing and complex needs of American Indian and Alaska Native populations. So, for example, the fiscal year 25 tribal request for mental health funding was over 3,000% higher than current levels, underscoring the severe funding gap and the need for more flexible long-term solutions. Barriers to accessing mental health services include economic constraints, lack of awareness, stigma, and a shortage of culturally sensitive care. Many American Indian and Alaska Native individuals also encounter mistrust of healthcare providers and insufficient integration of mental health with primary care. This toolkit seeks to bridge these gaps by offering practical, sustainable financing strategies tailored toward the American Indian and Alaska Native healthcare system, and by enhancing access to prevention, treatment, and recovery services for tribal nations, tribal health organizations, and UIOs. This toolkit aims to drive meaningful progress and support the overall well-being of Native communities. In summary, we hope that this toolkit serves as a crucial step toward addressing these challenges in funding and ensuring that your communities receive the comprehensive long-term support that they need. Next slide, please. So just a little bit about the importance of sustainable funding that we found through our research, and building upon the discussion from the last slide. The importance of securing stable long-term funding cannot be overstated, as it plays a crucial role in shaping the success of mental health initiatives and ensuring their enduring impact. So sustainable funding, we found, is essential for several key reasons, each of which significantly contributes to improving mental health care and outcomes in your communities. The first is enhanced access to care. So reliable and ongoing funding allows for the expansion and improvement of mental health services. This means that more individuals can access the care they need, including preventive and therapeutic services. And with sustainable support, programs can reach underserved areas, reduce wait times, and ensure that services are available when and where they are needed. In this toolkit, we're also going to look at funding for traditional healing. So integrating traditional healing practices into mental health care, we found through our research, can be vital for culturally relevant and effective treatment. Sustainable funding support these practices, ensuring they are not only included, but adequately resourced. This approach respects and incorporates Indigenous knowledge and traditions, which can be crucial for engagement in healing. Financial sustainability, so long-term funding solutions long-term funding solutions help organizations plan and implement programs with confidence, often avoiding disruptions caused by short-term funding cycles, which you guys shared in the poll. And financial sustainability allows for the development of robust programs that can adapt and grow over time. And then lastly, the importance of sustainable funding is developing a culturally safe or a culturally competent workforce. So this toolkit will also dive into the importance of investing in a culturally competent workforce for providing effective and respectful mental health care. Sustainable funding supports training and development for professionals who understand and respect Native cultures and practices. This will not only improve the quality of care, but also build trust within the community, leading to better engagement and outcomes. Next slide, please. So as we've discussed the critical role of sustainable funding in improving mental health care, it's also important to explore the process behind the creation of this toolkit. As I've shared, there have been a number of hands here at NCUE working on this toolkit for approximately the last 10 months. So I just wanted to share a little bit about how this toolkit was developed. This toolkit took on a community-based participatory approach. And as I said, it was a comprehensive and collaboratory process amongst many different folks, not just here at NCUE as well. So first, we started off with an extensive review of recent literature on behavioral health financing to understand any current trends and challenges within the field. We then analyzed data on federal grants to identify existing opportunities and gaps, helping us best align available resources. We reviewed Medicaid claims, and this data provided insights into the utilization of behavioral health services and highlighted areas requiring additional support. We also incorporated findings from NCUE's 2023 annual policy assessment that ensured the toolkit was aligned with current policy trends and advocacy efforts. From there, we held a number of focus groups from key informants in the behavioral health field, and their expertise and their input was invaluable to shaping the content. These focus groups were held in December of 2023 and January of 2024. And then following the draft of our toolkit this spring, we held 2 feedback sessions in May of 2024, and these sessions allowed us to present the draft, collect further input, and make necessary adjustments. We are still in the process of finalizing the toolkit. It will be going to our communications team for design in the upcoming week. And although we don't have the full toolkit to share with you today, we'll share a little bit more of when you can expect to receive a finalized copy. Next slide, please. I'm just telling we do have the title page that is already designed, so you can expect it to look a little bit like this, and we're really pleased to share that with you today. Next slide, please. So what are some of the key questions that we hope to answer within this toolkit? The first was really looking at what are the strategies to finance behavioral health services, and this would include mental health services, substance use prevention, treatment, and recovery services, as well as harm reduction services. The second question that we hope to answer in this toolkit is how do these strategies that we present strengthen the financing of behavioral health services, knowing how important staffing is and how critical it is. We do have sections within the toolkit looking at different staffing models that are needed to support the implementation of each behavioral health financing strategy that we proposed. And then lastly, we looked at what are the potential limitations or barriers to implementing each behavioral health financing strategy. And although we have tried to be as comprehensive as possible with the strategies we've developed, we know that there are, many more. There are additional strategies that we did not dive into, and we also know that there are obviously great work that is being done that we just didn't have the space to cover within the toolkit itself. So next slide, please. In this slide, before we dive into the specifics of the toolkit, I just wanted to share some qualitative data that highlights the real world context and challenges faced by those who helped inform this toolkit and are working directly in the field. I felt this slide was important just because qualitative feedback is crucial, as it really helped to provide a deeper understanding of the complexities that just our surveys or quantitative data alone might not be able to reveal. So what we did here as a theme was the complexity of funding and also requirements. So one key theme as one respondent noted, is that we have 7 different Medicaid plans, and they all have different requirements, and they all have different processes. This variability adds significant challenges to aligning services and funding opportunities. Another recurring theme that we heard in our focus group was the difficulty in accessing and choosing among numerous grants. Many folks shared that there are so many grants out there right now for behavioral health. The hardest part is deciding if it works for you based on your outcomes and evaluation. And we found that this really emphasized the need for clearer and more accessible data to support effective decision-making when choosing between which grants to apply to. Additionally, for many of our respondents, there was a strong focus on maintaining traditional practices within modern behavioral health programming. One respondent shared, we may not have wandered far from our traditional roots and focus on the community. This integration of traditional healing practices, for many we found is crucial for culturally relevant and effective behavioral health solutions. And then workforce also came up as a really significant theme throughout our research gathering. So the need for collaborative approaches and diverse staffing models also emerged strongly. For example, suggestions including working collaboratively to integrate nutrition, behavioral health, and physical health services, and the incorporation of behavioral health aides and peer support specialists to enhance support and care also came up as being important. Next slide, please. So I wanted to share our toolkit table of contents. It's a pretty straightforward, as far as toolkits go. It is lengthy, so it's really not meant to be read cover to cover, but to, pick and choose which strategies or sections might be relevant to the work that you're currently conducting. So the first 2 sections of our toolkit, the behavioral health landscape and the patient journey, provide the essential foundation and context for understanding the core of our financing strategy. So it really sets the stage. As far as the behavioral health landscape section goes, as I shared, this section sets the groundwork by offering a comprehensive overview of the prevalence and impact of behavioral health issues in American Indian and Alaska Native communities. It examines the historical, cultural, and systematic factors that contribute to unique challenges, helping to clarify why specialized, culturally informed financing strategies are necessary. Following this, we explored the patient journey, highlighting the importance of recognizing the human side of behavioral care, healthcare. And this section emphasizes that financial decisions are not merely abstract numbers, but have real-world implications for individuals seeking support during their most vulnerable times. Understanding this journey is crucial for creating financing solutions that we found truly address the needs of patients and their communities. And by establishing this context, we ensure that subsequent discussion of financing strategies is grounded in a deep understanding of the challenges and realities faced by Native communities, leading to more effective and meaningful solutions. Next slide. Oh, sorry. And then section 4, we're going to dive into in a minute, really looks at those 5 strategies that we've talked about, and we'll go into those strategies in a minute. Section 5 ties it all together, really looking at the importance of creating a strategic plan, and then it'll look into just examining the definitions of graded funding or blended funding as part of your strategy. And then lastly, section 6 is a resource section where you will find a plethora of resources to begin implementing these strategies within your organization to address funding needs. Next slide, please. Great. So at this point, we will dive into these 5 strategies that were informed primarily by what we heard in the focus groups of what the challenges were, but also, what was working within some of these organizations that have found success. So slide 20 outlines strategy 1, which is enhancing behavioral health care access through optimizing Medicaid reimbursement. So we heard in our focus groups that despite the significant need for behavioral health services, there is a notable gap between patient needs and Medicaid reimbursement. In each of these strategies that we do present, they're organized structurally in a very similar manner. So we'll start out with some background and data, which I'm going to share in a minute. And then where pertinent, we have an applicable example. And then we really talk about, sharing additional resources or strategies for implementing these strategies. So just a little bit of background research that we came up with in our research. So we found that obviously Medicaid is a vital source of health coverage for American Indian and Alaska Natives, with 30% of non-elderly and 44% of children in these communities currently enrolled in Medicaid or CHIP. The IHS system heavily relies on Medicaid, as demonstrated by 724,000 IHS patients enrolled in Medicaid in 2019, and 59% of American Indian Alaska Native patients at UIOs being Medicaid beneficiaries in 2022. Medicaid not only provides essential health services, but also serves as a critical revenue source, with IHS collecting over $1.4 billion in Medicaid funds in fiscal year 23. Behavioral health services, though underfunded, are crucial, with Medicaid being the largest payer for mental health services in the U.S. Despite this data, Medicaid reimbursements for behavioral health services does remain low, highlighting the need for strategies to optimize Medicaid reimbursement to enhance behavioral health care access. So to address this disparity, strategy 1, as I shared, focuses on optimizing Medicaid reimbursement. And a key approach is pursuing federally qualified healthcare center designation, which can substantially increase reimbursement rates, as shown by that third box there. Our research showed that facilities with FQHC status receive an average of $72.10 per outpatient mental health claim, compared to just $18.40 without that designation. Next slide, please. Additionally, integrating behavioral health services into primary care can streamline billing and enhance care coordination, further improving reimbursement opportunities. And by adopting these strategies, facilities can better align financial resources with patient needs, ultimately enhancing access to essential behavioral health care. Next slide, please. And as I've shared, within this toolkit, we will always try to point out best practices for implementing these strategies. And so this slide just has some bullets on how we've presented that you might be able to implement this strategy. Next slide, please. So going on to strategy 2, we now turn to the role of traditional healing in behavioral health services. So integrating traditional healing practices can lead to increased engagement and participation by aligning with cultural values and beliefs. These practices often resonate deeply with individuals, fostering a more inclusive and supportive environment for treatment. We also found through our research that traditional healing can be cost-effective, requiring fewer financial resources compared to some Western medical interventions. This approach adopts a holistic perspective, addressing the physical, mental, emotional, and spiritual aspects of health. And by incorporating traditional healing methods, facilities can enhance health outcomes and reduce long-term health costs, making it a valuable complement to existing treatment options. Next slide, please. So we found in our research that many focus group respondents highlighted the incorporation of traditional healing practices into their behavioral health services, noting its effectiveness in increasing patient engagement and participation. Financing these traditional practices emerged as a high priority as they offer culturally resident and holistic care. One innovative approach reported was registering traditional healers with a national provider identifier record, which made these practitioners eligible for Medicaid reimbursement. Previous NCUE research supports aligning traditional healing services with existing behavioral health coding systems to facilitate reimbursement. So, for example, practices like talking circles can be billed under the category of group therapy, bridging the gap between traditional therapy and traditional methods and Western therapy models. This alignment not only validates the importance of traditional practices, but also ensures that they are financially supported, enhancing their integration into comprehensive behavioral health care. Next slide, please. Strategy 3, which we propose in this toolkit, focuses on cultivating funding opportunities to enhance behavioral health programming by tapping into federal, state, local, and private grants. As many of you shared in the poll and what we heard in focus groups, federal and state grants play a crucial role in supporting behavioral health services, and federal and many of you also shared that your behavioral health programs are funded through various grants, underscoring the importance of diversifying revenue streams. Cultivating funding opportunities is important to your programming. And by accessing federal, state, local, and private grants, behavioral health programs can broaden their impact and ensure long-term viability. This section of the toolkit offers practical guidance on securing and optimizing these resources, providing healthcare executives, administrators, tribal leaders, and medical professionals with the tools needed to strengthen and sustain their behavioral health services. Next slide, please. So diving into strategy 4, strategy 4 highlights investing in prevention as a crucial strategy for enhancing behavioral health financing in Indian country. So effective cost reduction and resource management strategies we found are essential for ensuring sustainable and impactful behavioral health services. So this strategy involves a multifaceted approach that looks at prevention, behavioral health integration, and crisis care. Focusing on these areas, we found can not only improve health outcomes, but also ensure more efficient use of resources, ultimately leading to a more sustainable and comprehensive behavioral health system. This section of the toolkit dives into each of these strategies, prevention, BHI, and crisis care, exploring their importance and providing actionable steps for implementation. Next slide, please. So with regard to prevention, we found that preventative efforts focus on early intervention programs to detect and address behavioral health issues before they escalate, along with education and outreach initiatives to raise awareness about mental health and available services. Promoting healthy lifestyles also plays a significant role in preventing the onset of mental health disorders. Integrating behavioral health services with primary care is another key approach. Improving early detection and treatment through collaborative care models where primary care providers work with behavioral health specialists. Training and support for primary care providers is essential to better address behavioral health needs. And additionally, crisis care is vital with the establishment of crisis intervention services such as hotlines and mobile crisis teams and the development of crisis stabilization units to provide short-term intensive care and prevent hospitalization. Enhancing community-based support systems, including peer support networks and respite care, can further strengthen crisis care efforts. And on this slide, and within the toolkit, we do present, some ways that we heard through our focus groups that different organizations are using preventative efforts in their care. Next slide, please. This slide is a slide which just shows how in our toolkit we show some strategies or steps for implementing. For this one, it's behavioral health integration. So within the toolkit, we really try to break down how you might be able to create a plan within your own organization. Next slide, please. And then the last strategy that we do talk about within the toolkit is really looking deeper into how you can build a sustainable workforce with telehealth services and workforce expansion strategies. A theme that we did hear in the interviews that we did conduct last winter was really the difficulties that different organizations are having in terms of having that robust behavioral health workforce. So this strategy addresses innovative approaches to workforce capacity building, dives into creating a culturally safe space with culturally competence training for behavioral health staff, and then it also dives into looking at telehealth expansion and support. Next slide, please. Additionally, this strategy looks at specific ways to address workforce shortages. So, for example, utilizing psychiatric mental health nurse practitioners, implementing peer support models, which we heard many are doing successfully, adopting open access models, and also utilizing community health workers or community health representatives to address workforce shortages and strengthen behavioral health services. Next slide, please. Yeah, and also within this strategy, we look at just cost effectiveness in creating that culturally competent workforce. And we have, outlined ways to implement that training within your organization as well. Next slide, please. And then within this strategy also, we dive into expanding telehealth infrastructure and support, particularly in remote and underserved areas that have limited behavioral health resources. And by developing and enhancing telehealth capabilities, we've learned that geographic barriers are reduced, enabling continuous and immediate access to behavioral health care when it is needed. Telehealth not only makes it easier for individuals in these remote locations to receive care, but also helps maintain consistency in treatment, which can lead to better health outcomes and overall cost savings. We found that with robust telehealth support, patients can access timely interventions and follow-up care without the need for extensive travel, thereby increasing efficiency, improving the reach and quality of behavioral health services. And I know I went through those 5 strategies pretty quick. Within an hour, we don't have the time to dive into them, but within the toolkit, you'll really see, that we've provided the resource, an applicable example, and then ways to implement these strategies within your organizations. Next slide, please. And as I shared in the table of contents, the last section of our toolkit really tries to tie, all these different financing strategies together, help you and your organization create a roadmap for sustainability. So this section really underscores that relying on a single funding source is often inadequate for addressing the full spectrum of behavioral health requirements within your organizations, and to ensure the long-term viability and effectiveness of behavioral health programs. It really is crucial to diversify funding streams and develop a well-rounded strategy. By understanding and integrating various funding opportunities and community resources, it's our hope that your organizations, through this section, can build a sustainable framework that supports continuous improvement and adaptation of the services that you provide. Next slide, please. Great. And this slide, the QR code on this slide, if you do click on it, you can click on it and then save the URL that it does take you to. The toolkit will live on this page. We anticipate that it's going to be complete sometime next month. However, if you opted into our newsletter when you signed up for this webinar, you will receive the press release, as well as this toolkit will also be shared out in NCUE's newsletter. If you don't want to receive our newsletter, Molly can also drop my email into the chat as well, and we can make sure that once the toolkit is launched next month that you will receive a copy of it. Next slide, please. And with that, we'd love to open up the floor to any questions or discussion. It doesn't need to be a question. We'd also love to hear what strategies are working for you, or even challenges that you might be facing. And you can take yourself off mute. I see in the chat it says hand raised, but I don't have the capability to see that on my screen.
Well, I'm happy to go first. Although Dr. Linda raised their hand before me, so why don't we start with Dr. Linda?
You're too nice a guy, Ken. So I was just wanting to make a comment that, I know in the Federal Register and all the federal agencies, they use the term cultural competence. And I started to write in the chat, but it's too long and I don't type that fast. But in my clan's opinion, and a lot of my collaborating clans, we don't believe that two-leggeds can ever be competent in culture. And I say that from experience in working with newly graduated grant officers who tried to tell me, and I'm 74 years old, what culture is. And it's like, well, this isn't going to go well, and it usually didn't. And so and I'm a professor at the University of Minnesota, I teach a class in cultural humility. And that is my most fun class in the entire world, because I don't have the answers, but I help students to find their own. Basically, the point about humility is the fact that you don't stop learning, and people cannot stop learning. And by using just that simple darn term of competence, they have a federal curriculum for it, and they get the little plaque on the wall, and all poof, they know more than you do. It's like you've been doing this for your entire life. So that's just my rant on that. Just something to consider, to think about.
Thank you. I appreciate that. And we do trainings here, and we do use the approach of cultural humility as well. So maybe we will change the wording in the toolkit to reflect that. I appreciate that comment.
Thank you.
Thank you, Dr. Frizzle. I just want to comment to that. It's really has been a interesting and challenging journey, because we know that some tribal nations, indigenous populations throughout the world even, are in the position or stance to protect traditional healing. And so how far do you take that? And how do we get everybody on the same page, so to speak, in the world of behavioral health, mental health services, whether they're non-native or not, to really truly understand all the different aspects, the complexities of this, initiative, but yet be able to be in a position to have a humble state of mind and understand what could we learn about, what is off limits, and how do we integrate? And so that's a question that continues to also be a part of our discussion. And I think that is something that we can generally encourage to, in this toolkit, to recommend to have these discussions at that local level, and to have all of these entities that provide services to our American Indians to own that, to have that autonomy, to really be able to build that at that local level and to institute that. So we can talk all day about it, but I love your comment and recommendation and thoughts. So thank you.
Thank you.
So
Yeah.
there's an old blues artist named Albert King, and he wrote a great song. Everybody wants to go to heaven, but nobody wants to die. Um, in the work we're doing using mobile technology to address diseases of despair, you create peer chats for people on the pre-contemplation, contemplation, and preparation phase, and then you refer to clinical services. We presented to one urban Indian health organization. I did, and it was the worst 15 minutes of my life. Now, I did a bad job, but they looked at me like I had a third head, and I don't even have a second head. So my question is, how do we actually, since the drugs changed, income inequality changed, the pandemic has happened, we have all kinds of different divisions in the social fabric, plus the well-earned distrust, tribal members, and I'm a member of the Oneida Nation of Wisconsin, the well-earned distrust we feel towards systems. How do you actually innovate given that there are plenty of 58 to 60-year-old people who are running these organizations who just want to get to the end and think they can process the process a little better, and it hasn't worked yet. So where is the opportunity for real disruption?
I'm not sure I have the answer to that. Evey, do you have anything to add, or maybe somebody else in the room as well? Feel free to jump in.
Yeah. And please, by all means, when we were embarking this work with Pew and inviting tribal nations, 638 facilities, IHS, urban Indian health, and all nonprofit private sector that provided care to American Indians, Alaska Natives, we really had a different and varying types of responses on how they were addressing their how they're meeting the needs of the populations they are serving in the respective communities, and they all varied. And I understand that we do need to drastically change things to immediately have impact, right, on a lot of the statistics that we hear constantly in Indian country. We don't have the answers, but we also hope that through this toolkit that it motivates leadership. It promotes leadership, but also not only leadership, those responsible to bring in grants, work on third-party billing, have innovative approaches, but really to allow the entire workforce to be able to partake in those discussions at that local level. Our toolkit is very broad enough to allow autonomy for each of these organizations to institute not all, but various aspects of it. And I think what we've done, we tried our best to incorporate recommendations from the local level, like Alaska. I want to, if it's okay, Ken, I'd like to move into one of the questions that's coming up about how do we integrate.
Feel free. That was, you said discussion, so I thought I'd throw a provocative question in there. What
Sure.
you're doing is wonderful. That is great stuff. And I appreciate it. The hardest thing in the world to do is tell perfectly well-intentioned do-gooders the work is insufficient. And currently we're bringing soup to people who don't have a bowl and a spoon. And I love what you've done here. So thank you.
Yes, thank you for those thought-provoking questions. And I think it's a universal question that I think in Indian country we continuously ask ourselves. We ask ourselves, am I making an impact? Am I improving the services that I'm providing to the community members that we serve on tribal lands and urban settings and everything in between? Because we are a very migrant population. But we've done our best to really try to provide examples in the toolkit, real live examples from Indian country where they've been really innovative in, for example, one of the questions from Adam, you're asking, how are we incorporating CHRs, CHWs, behavioral health, mental health services? We've provided some examples in the toolkit from various organizations across Indian country. One of them, for example, Alaska, using telemedicine and technology to really try to meet the needs in the community in these rural settings. We also have examples of in urban settings where we might have mobile units where we're taking our services outside of these clinic walls and utilizing our community health workers, our local people who know the language, who speak the language, who understand mental health, behavioral health from the perspective of that tribal community. How do they define that imbalance? And how do we incorporate those different modalities and approaches into that work? So we're excited. We hope that the toolkit will lend some, recommendations in those areas. So, so you'll see, Adam, Mr. Fernandez, in the toolkit, a section that specifically talks about utilizing technology and the different kinds of workforces to enhance our services in those respective ways. I'm sorry, Liz, were you or somebody else, were there other comments?
Carrie just had a comment that partnerships are vital. And we did hear that throughout our research, and where applicable, we do address them. And certainly in the last section, tying it all together, we do talk about having those community partnerships, especially, where one organization can't do it all. And we're looking at, social determinants of health and addressing a lot of different problems that, one visit or one time, that having those partnerships and resources within the community is super important.
I'd like to add, may I, that I'm glad that you're having this seminar. You did this study on sustainable funding. So many grant programs that I was participating as a manager or just a worker or something. That's what community has come to know. And they've come to say, when we do our community assessments, collecting data, they're like, oh, this program will just last a few years and it'll be over. But what happens to our people after that? You all disappear and we don't see you forever, especially the old people that really care. And so, that sticks in my mind every time I'm working for a program, is how can we keep this program going? And I recall being at a grantee meeting, and we had an evaluator from the Surgeon General's office there, and he was like a fly on the wall until it was the end of the conference. And then he came and he spoke and he said, with this grant, he goes, normally you see grantees their first year, they're just hiring staff and trying to figure out what they're doing. And then somebody spoke up for us grantees and said, well, this grant is based on culture, traditional healing, and spirituality. It's the first of its kind. But what do you expect? This is their way of life. Of course, they're going to, I waited for my money and then grant money. And I had like my first event 2 days later, as soon as it was in the bank. We didn't have to wait for anything. We already knew what we were going to do, our objectives, our goals, and how it was going to be preventive. And it was all traditional. And so, that's the other impact, is knowing where your community, your audience, your people, and, the activities that you want to do. And that helps save money. You can jump into it, and then you have buy-in. When you have the buy-in and the support, you get donations, you find other resources, you find partners. And so I just wanted to say that much as far as my experience went with it. Thank you.
Carrie, thank you for sharing those thoughts. And I think that you'll see in the toolkit in each section of the strategies that we're recommending, there are policy implications. And so we've had policy experts weigh in and really trying to evoke the way we think about different strategies, but look at the policy implications, whether it's with Medicaid, the recommendations from Indian country, or even traditional healing, making sure that CMS understands that we're able to bill for certain types of services. Now, I will say by what is approved from Indian country, because certain traditional modalities and approaches are very well protected to this day. And some of the smaller tribal nations, for example, may not want those to be a billable type of services because it is something that is rooted deeply and continues to be practiced. These traditional ceremonies are to be protected. And so we have to really look at those. So Carrie, thank you for that comment and understanding your population you serve, and then understanding what you're able to incorporate at that local level and being able to infuse it. Not only is it become a part of the treatment, but these are the original public health protective barriers that become a part of your preventative measures, your preventative effort and approach. So I just wanted to make that comment and share that there are policy implications in each of these strategies as well. For if your organization works with a team of lawyers that can help advocate at that state level, it also is going to be read not only by NACUI, right, but National Indian Health Board, the National Congress of Indians. So there's sections in there that people can really look at and say, how can we push a certain policy initiative that impacts and enhances and encourages the way we provide healthcare, behavioral health in Indian country. I will pause there. I really, I will mute myself. I promise you.
Thanks, Evey.
I'm going off. Yeah.
Yeah. And it looks like we're at time to wrap up the discussion. But I really appreciate this lively discussion. I know we could probably continue for some time, and so perhaps in a webinar down the line, we can continue, this really important discussion. So just to wrap things up, if you have a few minutes to complete the survey, we always want to improve that work that we're doing here at NACUI. And you can put in additional topic ideas or learning collaboratives that you might like to see continued. So if you have a minute, take some time for the survey. And next slide, please.
May I ask?
Yep.
In order for me to take a snapshot of that QR code and link to it, I would have to use my personal phone, and then it goes to a different link. Can you drop, and I try to click on the link. Is it possible to drop the link in the chat, please, for the survey?
Yes. Yeah, we'll drop that in, Dr. Mayer.
Thank you so much.
Of course. And just we wanted to share, especially with our UIOs, we do provide one-on-one technical assistance on a number of different topics. So Molly will also drop that into our chat as well. And then next slide, please. And then lastly, we do have a busy webinar season coming up. All of these webinars can be found on our webpage, but here's just a little snapshot. We have some webinars coming up on HIV navigation for UIOs. We've got a couple of focus groups coming up for our UIOs, and then everything from infection prevention to data sharing. And then we do have a webinar coming up at the end of next month, which will be on grant writing and grant requirements for sustainable planning. So that might be one that is pertinent to the folks in this audience as well. And last slide, please. And again, I just wanted to thank everybody for joining today. I know our time was really only an hour and there was a lot to present. I wish we had a little bit more time for discussion today. But keep your eyes out on for our newsletters where we will, and our press release where we will be announcing when the toolkit will be available to you. And then you should all, take mine and Evie's email addresses. So if there's anything else that you'd like to touch base on with regard to this toolkit, we'd be more than happy to follow up with you. So again, thanks everybody for joining today and your appreciation for your participation.